The very first thing that got me confused when I started my PhD was the concept of index date. I didn't know what it meant, and when I got it wrong, it didn't throw me an error. The analysis still ran, and the results looked kind of fine, but they were actually highly biased. Index date is a reference time point in the study that defines a patient's timeline. It affects how we measure clinical outcomes, and the tricky part is that there are many different types of dates in a health record. We have the diagnosis date, event date, consultation date. And picking the wrong one as your starting point could ruin your entire analysis without you even knowing. My name is Warren. I have a PhD in epidemiology, and I have spent years analyzing real hospital data. Today, I'm going to walk you through what index date actually is and how defining it differently could change your results. In many observational studies, we are often interested in looking at the relationships between different health variables. For example, in my PhD, I was really focused on looking at the increased risk of heart diseases or CVD among hip fracture patients. And before we run any kind of analysis, usually the first step we have is we have to construct a patient cohort first. The very first step is really obvious. We have to find all the patients with hip fractures. And the second step is we have to set a study start date. So that is the focus of our video here. The start date could be called index date or day zero of your analysis. As often, what we're doing is for each patient, we have to construct a timeline for him or her. We have to set the starting point, which is the index date. This is the date in my case that reflects the hip fracture event. And then we have to define a follow-up period. Say it could be 1 year after the hip fracture event. And what we're doing is we observe whether a CVD event occurs during this follow-up period. If it occurs during this period, then we will treat it as a clinical outcome. And if you are doing an electronic health record study like I did, then you usually have some kind of table or data set like that. You have the patient ID, then you have an identifier indicating whether the patient had hip fracture or not, and then you have a date variable. Say if we want to quickly convert this type of data into a visual timeline, it would be something like that. So this is the timeline for the first patient, where the event date is the 1st of May 2003. This will be the starting point of your analysis. The period that occurred before the index date is what we call the baseline period. If there's a CVD event that occurred during this period, we wouldn't count it as an outcome. It's part of the clinical history of this patient. But say if we observe a CVD outcomes after this index date within this follow-up period, this will be a real outcome. But the tricky problem is what date we should use for our index date. You see, just now I didn't give a lot of thought on that. I just see the event date variable in the database, so I directly use that as my index date. But often using an ambiguous date variable like that may not be a good choice. Often in many EHR databases, we have many types of date variables like that. The tricky part is that it's difficult to know the true meaning behind this type of date variables. For example, is it the date where the hip fracture event was being diagnosed? Or was it the date of the hip operations? Or it could just be the date where this hip fracture record was entered into the database. You can see that it could mean anything, and different hospitals could have different practice of defining the event date, which makes it really tricky to make sure that the data of each patient, they are really consistent. So therefore, in practice, we are actually more interested in using some well-defined date variables as your index date. So say variables like the hospital admission date, hospital discharge date, or procedure date. For example, hospital discharge date is the date where the patient left the hospital. And for my case, I actually use the hospital discharge date as my index date, and I will explain why very quickly. But I want to give you a concrete example of what happened when I make this switch. So before, the event date was used as the index date. Now I'm changing my definition and making my discharge date as my index date. And remember, by doing so, I have to move my follow-up period as well, because follow-up period was defined from the beginning of your index date. So once we have made this change, you can see the CVD event now becomes something that occurs before the index date. So it becomes part of the history, but not as part of the future of this patient. And with this change of definition, you can see for this patient, now we couldn't see a CVD event that occurs after the index date. Some people might definitely ask, like, why I'm excluding this event. This is actually something that occurs when the patient was in the hospital. Shouldn't we count that as an outcome as well? So that really depends on the goal of your study. For my PhD study, I was mainly focusing on the long-term care of elderly patients. So if I include this CVD events that was recorded during hospitalization, I actually might have some issue with my analysis. When a patient entered a hospital, he or she might need to do many different types of tests. So a test could identify some pre-existing conditions that the patient had. So since this could be something that actually will already exist before the hip fracture, I wouldn't want to include them in my analysis. And also, a CVD events that occur during hospitalization could be due to some complications due to some procedures or medications within the hospital treatment. So again, since my study was mainly interested in the long-term care of this patient, so for me, it actually makes more sense for me to exclude this kind of events from my analysis. And once I'm using the hospital discharge date as my index date, the advantage is that I now have a cleaner timeline of the patient, capturing everything that occurred after the patient returned to their communities or their home. If I observe a higher risk of CVD among these hip fracture patients, which I actually did in my PhD, that's actually served as a strong evidence supporting the importance of the monitoring of CVD conditions among these patients who have left the hospitals. There's no single rule on what date to choose as the definition of index date. The most important point is to make sure that your index date matches what you're trying to study. If I'm looking at long-term outcomes after hospital discharge, then using hospital discharge date as the index date makes sense for me. But say if you are interested in looking at complications or acute outcomes during hospital stay, then using the hospital admission date might make more sense for you. It sounds obvious, but I've seen myself and many other people who sometimes were tempted to just use any date variables that were convenient and most available to them, rather than choosing a date that makes most clinical sense. So next time you work with health record data, before you run any analysis, remember to define your index date properly and make sure that everyone on your team is on the same page. If you want to learn more about data science and AI in healthcare, subscribe to my newsletter. The link is in the description. I will see you next time.